care is in nursing. It's an essential part of patient care, especially for those in nursing homes or those with chronic conditions. A wound, if not managed properly, can lead to serious complications, from infection to severe pain, and even long-term disability. It's not just about the physical aspect, but also the emotional toll it can take on a patient. Nurses play a pivotal role in wound management. They assess the wound, monitor its progress, and devise a care plan. They also educate the patient and their family about the wound and its care, providing them with the necessary tools to prevent further damage. This can range from teaching them how to change dressings to advising on lifestyle changes that can promote healing. In essence, wound care is a multifaceted process that requires knowledge, skill, and compassion. Understanding and managing wound care is a key skill for nursing professionals. Opening. What steps do nurses take to assess a wound accurately? The journey of wound assessment begins with a crucial step: gaining consent from the patient and explaining the purpose of the assessment. It's not just a matter of courtesy, but it contributes to the patient's understanding and cooperation during the process. Next, we gather the needed equipment for both assessment and wound care. This could range from gloves and dressing materials to specific tools for measuring wound dimensions. It's always about being prepared and ensuring patient safety. Now comes the time to put on our detective hats. The wound needs to be inspected thoroughly. We're looking for clues that tell us more about the wound's nature and its healing process. We examine the wound type, category, location, dimensions, edges, the condition of the wound bed, the amount and type of exudate, and the skin surrounding the wound. We also need to account for the patient's pain level and risk factors associated with the wound. But wait, there's more. The wound doesn't exist in isolation. It's part of a person, and that person's overall health and lifestyle can affect wound healing. That's why a holistic and nutritional assessment is also vital. We consider factors like the patient's diet, lifestyle habits, stress levels, and overall health status. All these can give us insights into how well the body can respond to wound healing. And yes, sometimes we might need to take a photo of the wound, especially if there's a need for tracking progress over time or for consultation with other healthcare professionals. But remember, this should always be done with the patient's consent and in accordance with privacy and confidentiality guidelines. Lastly, we document everything. Every aspect of the wound and the patient's overall health status needs to be recorded accurately. This documentation forms a vital part of the patient's medical record and aids in monitoring progress and planning for further care. Closing. A thorough wound assessment is the foundation of effective wound management, and that's exactly what we aim for as nurses. Effective wound management that promotes healing, reduces pain, and enhances our patients' quality of life. What complications can arise if a wound is not managed properly? That's a question we all need to have the answer to. Let's delve into it. When it comes to wound management, there are several potential complications that could arise if not handled properly. One of the most common complications is infection. Bacteria can easily enter an open wound and cause a myriad of problems, from mild irritation to severe systemic infection. Next on our list is necrosis, or the death of tissue around the wound. This can lead to further complications, including gangrene if not treated promptly. Another complication could be delayed healing. Factors such as poor nutrition, stress, and other underlying health conditions can significantly slow down the healing process. So, how can we prevent these complications? Health education is key. By understanding the importance of proper wound care and hygiene, patients can significantly reduce the risk of complications. Being aware of potential complications helps in preparing a comprehensive wound care plan, and that's what we'll be discussing in the next scene. Stay tuned. How do nurses plan for effective wound care? When it comes to wound care, planning is everything. It starts with a thorough assessment of the patient's pain and the wound itself. Nurses must carefully observe and document the type, location, and dimensions of the wound, along with the condition of its edges and bed, the amount of exudate, the state of the surrounding skin, and any associated pain or risk factors. This comprehensive understanding of the wound forms the foundation of the care plan. Next, the nurse must consider the principles of wound assessment. This involves understanding the wound's physiology, including how it developed and how it is likely to heal. The nurse must also consider the patient's overall health, as factors like nutrition and lifestyle can significantly influence wound healing. Once the nurse has a clear picture of the wound and the patient's health, they can start designing a wound care plan. This plan details the techniques and procedures that will be used to care for the wound, such as cleaning, debridement, and dressing. It also outlines any necessary pain management strategies. But a wound care plan isn't just about treating the wound. It's also about preventing further injury. That's why nurses incorporate preventative strategies into the plan. These might involve repositioning the patient to relieve pressure on the wound, providing nutritional support to promote healing, or educating the patient on how to care for their wound at home. The wound care plan isn't set in stone. Nurses must continually review and adjust the plan based on the wound's progress and the patient's response to treatment. This might involve consulting with other healthcare professionals, such as dietitians or physiotherapists, to provide the most comprehensive care possible. In essence, wound care planning is about more than just treating a wound. It's about understanding the patient's needs, using evidence-based practices, and working collaboratively to promote healing and prevent further injury. A well-thought-out wound care plan can make a significant difference in a patient's recovery. How important is the right dressing for a wound, you may ask? Well, the answer is immensely. The dressing is like a shield, protecting the wound from bacteria and further injury while creating an optimal environment for healing. Now, not all wounds are the same, and neither should be the dressings. You need to choose a dressing that suits the wound type and its current stage of healing. For instance, an absorbent dressing is ideal for a wound with heavy exudate, while a hydrocolloid dressing works wonders on a dry wound. But choosing the right dressing is only half the battle. The way you apply it matters too. This is where the aseptic non-touch technique comes into play. It's a method that minimizes the risk of introducing harmful microorganisms into the wound. And let's not forget about infection control principles. Always remember to sanitize your hands, use gloves, and properly dispose of used dressings. Choosing the right dressing is a crucial part of wound management. It's like picking the right armor for a battle. And in this case, the battle is for healing. How can patient comfort and education aid in achieving wound care goals? When it comes to wound care, comfort and education are two key elements that can make a significant difference in a patient's healing journey. Let's start with comfort. It's no secret that wounds can cause pain and discomfort, which can, in turn, lead to stress and anxiety. These factors can hinder the healing process. Therefore, it is essential to make the patient as comfortable as possible. This might involve adjusting their position, administering pain relief when required, or simply providing a reassuring presence. Next, let's talk about safety. Ensuring the patient's safety is paramount. From infection control principles to the handling of waste generated, every aspect of wound care should prioritize the patient's safety. But comfort and safety are not enough. We need to empower the patient with knowledge, and this is where education comes into play. Educating patients about their wounds and the care they need can greatly enhance their understanding and cooperation. For instance, a patient who understands the importance of pressure injury prevention will be more likely to follow the necessary preventative measures. Education can also extend to resources. There are many resources available that can help patients understand their wounds better, from books and pamphlets to online resources. Providing these resources to patients can help them take an active role in their own care, which can significantly aid in their recovery. And let's not forget the significance of communication. Effective communication can help patients understand their wound care plan, why certain decisions are being made, and what they can expect throughout the healing process. So, how can patient comfort and education aid in achieving wound care goals? By reducing stress and anxiety, ensuring safety, enhancing understanding and cooperation, and promoting an active role in care. In conclusion, patient comfort and education are not just add-ons in wound care. They are fundamental aspects that can significantly contribute to the success of wound management. Patient comfort and education play a significant role in successful wound management. So, what have we learned about wound care today? We've dived deep into the process, starting with the importance of wound care and its direct impact on a patient's recovery. We've learned to assess wounds meticulously, noting characteristics like type, location, dimensions, and condition of the surrounding skin. We've explored how to identify potential complications, which allows for timely intervention and prevention of further damage. We've delved into the creation of a wound care plan, applying our knowledge of wound physiology and pain assessment findings. We've talked about how to select the right dressing, tailored to the specific type and stage of wound healing. And finally, we've underscored the value of making our patients comfortable and safe, providing education to help them achieve their wound care goals. Remember, effective wound care is a combination of careful assessment, thorough planning, and patient education. As nurses, you have the power to make a significant difference in your patient's recovery.